Hello, doctor.
Hi.
Nowadays, we see there are a lot of allergy cases increasing, especially we are talking about respiratory allergies. And we see many people trying to manage it at home. So, I don't think that's the right approach. So, what do you suggest to such people? How should they manage on a long term perspective?
So, allergies usually occur when our body reacts to an external allergic trigger. Now, these triggers can be in the air, such as dust or dust mite. It can be pollen. It can be any kind of allergic trigger that we inhale, such as noxious gases or smells. It can also be food allergens, such as egg or seafoods or wheat or whatever. And you also have various other allergic triggers existing in the environment. So this can either affect our eyes, nose or the chest. When it affects the nose, it's called as allergic rhinitis, and we get symptoms such as runny nose, nasal congestion, a blocked nose, sneezing, and sometimes it's associated with itching and watering of the eyes, and rarely it goes down to the chest also, and that's when we develop cough, wheezing, breathlessness, and a sort of chest tightness which makes us very uncomfortable. Now, all these allergic symptoms need to be differentiated from an infection, because patients more often than not come to me and say, "Doctor, I have a nasal infection or a throat infection or a chest infection." Now, how do you differentiate between these two is that these infections are often caused by viruses, and they're associated with either fever or a purulent sputum. That means your sputum or phlegm is either yellow in color or foul smelling. So allergies, on the other hand, exist for a longer term, and the secretions that come through your nose or when you cough out is usually clear and watery. So when you get these allergies, we need, first and foremost is, of course, prevention is better than cure. Try to find out what is causing these allergies and remove the allergic trigger, food or your environmental allergic triggers. Second thing is, of course, finding out what the allergen is and finding a treatment for it. For this, it's better you get in touch with your healthcare provider. And what we usually do is we take a good history and a clinical examination, followed by, if needed, blood tests or x-rays, and what is known as a pulmonary function test. It's a blowing test which actually assesses the capacity of the lungs and how well you can breathe. So with this, we'll be able to find out whether it has affected your chest and whether you have what is called as allergic asthma. Now, coming to the treatment, allergic treatment is similar for both nasal and chest. It consists of things like decongestants, which help to relieve the thick mucus, and mucolytics, which actually make it thinner so you can spit it out or blow it out through your nose. It also includes steroids. Now, a lot of patients directly come and ask me, "Doctor, does it have steroids? We are scared." But the important thing to note is that for every allergy, the mainstay of treatment is a steroid. Now, when we give a steroid as a nasal spray or as an inhaler, it is in a very, very tiny dose. It's in micrograms, not in milligrams or grams, and therefore it's very safe. Why? Because it acts only at the site of action. So if it is a nasal spray, it acts only on your nose, and if it is an inhaler, it acts only on the chest and does not go through the blood much to the rest of the body. Also, the other advantage is that the side effects are lesser and the effect is more. So you'll have more of symptom relief. The other thing along with that is, when it affects your chest, you need what is called as bronchodilators. So this is given in combination with the steroid inhaler along with antihistamines. Antihistamines are very commonly known. You might have heard of cetirizine or levocetirizine or fexofenadine, and we have newer generation antihistamines which do not cause sedation at all. Now, along with that, we also give certain nose drops if you have a nasal congestion, and these are usually given for a very short term for 5 days and should not be continued beyond that. And along with that, sometimes we also give some oral tablets to decongest your chest and make you feel better.
So, this is actually very good information, because there is a process to be followed, when you have these kind of allergy attacks, which means the patient can have a permanent long-term solution for this. Is much better than having a home-based temporary solution. I'm sure that there are a lot of procedures available at Maitra Hospital for various respiratory conditions. Ma'am, can you please explain about them?
We have a lot of procedures in pulmonary medicine for diagnosis as well as management. So the most common and the most simple of all is called as a bronchoscopy, which is actually a thin tube with a camera at the end. So you must have all heard of endoscopy. This is a similar procedure. The bronchoscope is a thin tube which is inserted either through the nose or the mouth into the airways to visualize the inside of the airways and the lungs. For example, a patient has a chronic persistent cough which we are not able to diagnose the reason for. It can be because there is blood in sputum. It can be because there is a persistent pneumonia which we are not able to diagnose or which is not getting resolved. For conditions where we see something on the chest x-ray or the CT scan of the chest and we want to find out what it is. And in children and even sometimes in adults, we have to do a bronchoscopy to remove a foreign body. By a foreign body, I mean things that have been aspirated into the airways, such as hairpins, and children very commonly put all kinds of toys or beads or even peanuts and things they aspirate into their lungs. And when we have to take that out, it's done through a bronchoscopy. So this bronchoscopy is a very simple procedure. It's done under local anesthesia, which is just a spray. The effect of the anesthesia wears off within half an hour, and the procedure is done on an OP basis usually, unless the patient has a lot of other medical issues and they require admission. A patient can usually go home after 1 to 2 hours. Now that is the most commonly done procedure, which is a flexible bronchoscopy. The second procedure, which is also very much similar to this one, but it is done with a scope at the end of which is a ultrasound probe is fitted. Now this is also done the same way, but we prefer to do it under a little bit of sedation assisted by the anesthetist. Now when is this procedure done is when there are lesions or small masses in the lung or in the area between the two lungs, which is called as mediastinum, or when there are lymph nodes in the mediastinum which we need to find out why it's there. So the advantage of doing this procedure, which is again a very easily done OP based procedure, is that we can get a tissue biopsy and we can reach a diagnosis much earlier. Both these procedures are very minimally invasive and can be done very easily. The third procedure is what we called as a medical thoracoscopy. A thoracoscope is again a very thin tube which is inserted through a keyhole which is made on the side of the chest. This can be done both under local anesthesia, or if the patient is very anxious and is requesting sedation, we can do it with the help of an anesthetist under a short sedation. General anesthesia is usually not required for any of these procedures. Now, when is a thoracoscopy done? Is when there is fluid accumulated outside the lungs. Now, outside the lungs, there are two coverings called as pleura. Now, these are very thin coverings, and in between these two coverings, fluid can accumulate or air can accumulate. So, when we need to diagnose it or treat it, we do what a procedure that is called as medical thoracoscopy. Now, these are the most commonly done procedures in our hospital on an OP-based setup.
Along with good food and exercise, actually sleep is also a very important part in having a good health. And we know that snoring is something which is actually troubling a lot of people in having a good sleep, not only for them, for people who are sleeping next to them. So is snoring actually a disease? How do we approach that?
So what happens when a person snores is that the airways collapse. Now the airways start from the tip of the nose through the trachea to the bronchi. So when a person snores, due to various reasons, due to obesity, due to signals from the brain, a lack of them, what happens is that the airways collapse and what is produced is the snoring sound. But inside what happens is that the breathing completely stops, and the stopping of breathing is called as apnea, and when it happens during sleep, it is called as sleep apnea. So when we do what is called as an overnight polysomnography, which is the test that is used to diagnose this obstructive sleep apnea, it is also called in common parlance as sleep study. So once the sleep study is done, we are able to assess how bad the sleep disordered breathing is. So we have a scoring system according to which we decide whether it's mild, moderate or severe, and depending on that the treatment is done. Overnight sleep study involves a patient having to sleep in their normal environment, and at that point of time various leads are attached to their chest, for example the ECG leads, and leads also on their head, on their eyes, and certain probes are placed on their chest to do the entire test. Now once the test is over, like I said, scoring takes place, and after that we decide on the treatment. Now what are the various kinds of treatments, you may ask? First is the lifestyle changes. So it's important that we eat, exercise and lose weight and have a healthy lifestyle. Number 2 is avoidance of things like caffeine, alcohol, smoking, and various things that may keep you up at night. It's very important to maintain a very good sleep hygiene. By sleep hygiene, I mean that we go to bed on time, lights out, we put away all kinds of gadgets, try avoiding caffeine, sodas, chocolates and other things after evening 4:30, 5:30 time, and you should have a regular food intake at night and then go to sleep on time. Now, these various measures include sleep hygiene, but that alone is not enough. If you have been diagnosed to have an obstructive sleep apnea, we need to have what is called as an auto CPAP titration. The CPAP device is a small device with a mask that is fitted either over the nose or includes both the nose and the mouth. And what happens is that air is pushed into the airways at certain pressures, which we determined through the overnight titration study. Now, what happens is when the air goes into the airways, the collapse is prevented and the airway remains patent, and that is how this sleep apnea is treated. Sometimes sleep apnea can also be treated by various other measures such as oral devices, by certain ENT surgeries, but the most effective of all is usually the CPAP therapy.
So thank you, doctor. I'm sure that this session would have given enough relevant information to our audiences about various respiratory conditions and how Maitra Hospital can effectively treat them. Thank you very much.
Thank you so much.